All of the following are true regarding atrial septal defect except atrial septal defect, also called as ASD. All of the following are true about ASD except, look at the options one by one. Can ASD be asymptomatic in many children? That is a true statement. Look at option number B. Infective endocarditis is generally not indicated. That is a true statement. Why? Because ASD is one congenital heart disease which has least risk of developing infective endocarditis. It is a past Fmge question already. Absence of shunt murmur, option number D, is true statement. What about option number C? Option number C is not correct. This is a false statement. And the answer to question number 2 is C. Why? Because in atrial septal defect, wide fixed splitting of second heart sound is seen in the patient. Wide fixed heart sound, splitting of second heart sound is seen in ASD patient, right? So let us do a quick review of the topic of atrial septal defect. What are the key points to remember from exam perspective? Rapid fire review of ASD. Atrial septal defect comprises 5 to 10% of all congenital heart diseases. Atrial septal defect, what is the most common syndrome associated with ASD? The most common syndrome associated with ASD is a syndrome called as Holt-Oram syndrome. If you find any topic additional, please add it to the notes later on, to the existing notes, and do revise them, because if you don't revise something, you will forget in the exam. You will not be able to remember it. Third point about ASD. ASD, there is a left to right shunt. It is characterized by a left to right shunt lesion, but the shunt size is small. And so these patients are found to be mostly asymptomatic. So which congenital heart disease is often asymptomatic and comes to attention incidentally? The answer will be ASD. Rarely, some patients can have CCF. Rarely CCF can happen if there is a very large ASD. About ASD, what is the hallmark finding? Hallmark means something which is always present in ASD. The hallmark finding is wide fixed splitting of second heart sound. Now, second heart sound has two components. There is an aortic component and there is a pulmonary component. In a patient of ASD, the pulmonary and aortic component become split and the gap between them is same during inspiration and expiration. If I have to show you diagrammatically, it will appear something like this. I'm writing on the side on inspiration and on expiration. Inspiration, this is S1. Let me put some gap between them so you can appreciate better. Expiration, this is S1. S1 is same. What about A2 and P2? Second heart sound becomes split into two components, A2 and P2, and the gap between them always remains the same. So can you see the second heart sound has split into two components, one due to aortic valve closure, second due to pulmonary valve closure, and the gap between them becomes wide. If they show this photograph and ask you what is the likely diagnosis, the likely diagnosis is atrial septal defect. Now, talking about the types of ASD, there are broadly speaking two types of ASD. You have ostium primum variety, which is a rare form and a more atypical form, and second is ostium secundum form. Ostium secundum is the most common type of ASD. If they ask you, this is a past MCQ point as well. If you have to distinguish between them, remember that when you do ECG, ostium primum shows left axis deviation. Whereas when you do ECG in ostium secundum variety, this shows right axis deviation. Two types of MCQs, clinical MCQs are asked in the exam. First question will say, an asymptomatic child is found to have wide fixed splitting of second heart sound. ECG was showing right axis deviation. What is the diagnosis? Answer will be ostium secundum ASD. But if they say wide fixed splitting of second heart sound, asymptomatic patient, and left axis deviation was mentioned in the question, the answer will become ostium primum ASD. In ASD patient, there is murmur which is absent. The shunt murmur, the true murmur in the patient is absent. The shunt murmur is found to be absent. Shunt murmur is absent, but flow murmurs, these are atypical murmurs due to aberrant flow. they may or may not be present in the patient, but they are not typical. The typical shunt murmur in ASD is absent. ASD, the complications are rare, and infective endocarditis, IE, is not seen. This is a past Fmge PYQ. Which congenital heart disease has least risk of developing infective endocarditis? The answer is atrial septal defect, and that is why you don't need to give infective endocarditis prophylaxis. What is the treatment in the patient? The treatment in the patient is surgery. If they ask you, it is a NEET PG question. Ideal age of surgery is 2 to 4 years. Ideal age of surgery is 2 to 4 years. Hassan Imam, pan-systolic murmur is not heard in ASD, it is heard in BSD patient. So remember the funda. If the examiner is saying pan-systolic murmur and examiner is saying wide variable splitting of second heart sound, and it will not be asymptomatic, patient is having congestive cardiac failure and pneumonia, this picture is pointing towards a diagnosis of ventricular septal defect. Remember, so watch out for the keywords, watch out for the important points, and you will always get the answer correct. So this is a quick review of the topic, atrial septal defect. The answer to question number 2 is C.